Bauman with We Are Change Colorado. I'm one of the organizers of Denver's Public Water Fluoridation Forum today. And pretty much what we heard from the side for fluoride, it was just safe and effective. And then they didn't show any proof. And from our side, we went through the exact reasons why fluoride isn't safe and effective, and we gave all the sources. And people just need to know that, you know, this is the same compound that's being put in Prozac. That it is known to reduce IQ, and you can check that out through Harvard studies. It's a known neurotoxin. Check out the Lancet study. I mean, make sure to back up your claims. And one thing I want to make sure that people know is it may have been used in fluoride may have been used in concentration camps in Germany, but we can't prove that. So be careful when you start making claims. Be careful with your claims, because we want to give exact proof. Unlike their side, who claimed it's safe and effective without any proof, we're going to back up every claim we have with the full, complete truth. So I just highly recommend sticking to the objective truth and not dwelling on things that we can't prove.
First, what's your name?
Amanda Dinkle.
And I notice you have a couple children with you?
I do. This is Joey and this is Katie.
And why is water fluoridation an important issue for you?
Because it does naturally occur in our water, and so I want to know what level is safe, and I don't think we should be adding it.
Are you concerned about your children consuming too much fluoride?
Yeah, oh yes, most definitely.
And what's the health concern with that?
The endocrine concerns. She's had the teeth staining, and
Your child has dental fluorosis?
Mm-hmm.
Goodness.
And she was formula fed from 4 months on because I couldn't breastfeed from 4 months on.
Why is water fluoridation an important issue for you?
It's important on a lot of levels, but one is very personal to me. When I was a kid, I had fluorosis on my teeth, okay? And a lot of the kids in the neighborhood also had fluorosis on the teeth. And guess what? I got a little boy. We're drinking Denver water. I don't want him to have the same experience I did.
What was your experience with fluorosis?
It's just ugly, you know, it's just an embarrassment. You know, I don't know how damaging it is to the teeth, but, you know, it's not preferable.
You didn't like the way your smile looked in the mirror?
No.
And you don't want your son to go through the same thing?
Correct. Pretty simple and straightforward.
Now, are there any other concerns you have about water fluoridation?
Yes. Chiefly, I mean, that it calcifies the pineal gland. And you could look that up on Wikipedia. It's very easy to discover if one were so inclined to do some searching and research.
Anything people should do or anything people should look up to learn more?
Fluorideactionnetwork.net is an excellent resource for information. But do your own research. Do a simple search on fluoride.
Hi, I'm making a video of the event. I was wondering if any would like to talk about your position.
No, thanks.
Thank you.
Sir, would you like to speak about your position on fluoride on camera?
No, thank you.
Okay, thanks for coming.
I don't have any to sign.
Excuse me, could I ask you a question about the toxicity of fluoride?
Sorry, we're not taking questions.
You're not taking any questions about the toxicity of fluoride?
We can refer you to the presentation that we just gave.
Thank you. What do people not know about water fluoridation that they should know when trying to understand this important issue?
I think the most important thing for them to understand is the body doesn't need fluoride. There's not one biochemical reaction, one molecule in the body that needs fluoride. It's not an essential nutrient. So it just doesn't make sense to swallow it, especially when you find out that it's also very toxic. So whilst it doesn't do any good to swallow it, it could do you some harm. So nature did pass a judgment on fluoride, and that's the level in mother's milk. And it's extremely low, 0.004 parts per million, which means if a bottle-fed baby, where the mother makes up formula with fluoridated tap water, that baby's going to get 200, 250 times more fluoride than nature intended. It's reckless. It's reckless. I say that mother's milk protects the baby from fluoride, and water fluoridation removes that protection. Well, we now know that 41% of American children aged 12 to 15 have dental fluorosis, and this is the telltale marker that the child has been overexposed to fluoride before their permanent teeth have come out. So you see this discoloration, mottling of the enamel. 41% of our kids, and now when they started fluoridation in 1945, they thought only 10%. To me, the thing which is reckless about this is that we know that the fluoride is interfering with the baby's growing teeth. We know that. But when that is happening, what makes people confident that it's not interfering with the baby's developing bones, developing brain, developing endocrine system? Of course, they don't know. And it's only now we are getting the studies from particularly places like China and India, which have high natural levels, and they are finding that fluoride lowers IQ, and many animal experiments which shows that fluoride damages the brain.
Are there potential damages of water fluoridation to adults, and what are those?
Absolutely. Fluoride accumulates in the bone. About 50% of all the fluoride you take in each day is excreted through the kidney. But the other 50% accumulates in the calcifying tissues, and most of that is in the bone. And we know that over a lifetime, that accumulation could lead to brittle bones. But the first symptoms of fluoride poisoning of the bone is just like arthritis. We do know is there's an epidemic of arthritis, and especially in fluoridated countries. And same thing with hypothyroidism. Doctors used to treat patients with fluoride to lower thyroid activity in Argentina, France, Germany, for 30s, 40s, 50s. And now we have millions of people with hypothyroidism, underactive thyroid gland. And again, it's not being studied. Their attitude is the absence of study is the same as the absence of harm, which of course is complete nonsense. But the safe level to protect all our children, not the average child, but all our children from lowered IQ is so low that many of our children are exceeding it before they drink a glass of fluoridated water.
Children are getting enough fluoride from other sources.
Right now to lower IQ.
And those sources are foods and beverages?
Food, beverages, air pollution, and of course particularly dental products for kids that are swallowing toothpaste.
And so they're getting enough fluoride that could potentially damage their brains.
Yeah, absolutely. And the shocking thing is, you see, why you need those margins of safety in anything, but particularly in a situation like this when you're exposing the whole population to a known toxic substance without any control over dose. Can you see what a ridiculous that practice is? If there's any indication of harm anywhere, it should stop, because you just don't have that margin of safety to protect everyone. And if you're a public health authority, your job is to protect everyone.